Today the subject is fixed prosthodontics. Main component of pyre abutment is placed on which side of pontic? That is mesial side of pontic or distal side of pontic, or mesial side of abutment or distal side of abutment. So the male component is placed on mesial side of pontic. And what is anti-slow? And it provides an aid for selection of pontic, selection of connector, selection of retainers, or selection of abutments. It provides an aid for selection of abutments. Recommended convergence between opposing axial walls which optimize retention is 6 degree, 15 degree, 30 degree or 45 degree. Here the answer is 6 degree. Principles of tooth preparation may be divided into how many categories? Is it 6 categories or 3 categories, 4 categories or 2 categories? Answer is 3 categories. Overall optimum degree of taper of tooth preparation for maxillary anterior tooth is 6 degree, 14 degree, 10 degree or 19 degree. Here optimum degree of taper of tooth preparation for maxillary anterior tooth. So it is 10 degree. The finish lines of complete coverage crown should lie supragingivally or subgingival if required, or subgingivally or gingival margin. Here the finish lines should lie subgingival if required. Type of gold alloy used in short span FPD. Soft gold or medium gold, or hard gold or extra hard gold. Here the answer is hard gold. Walls of full gold crown preparation should be parallel or any angle of convergence of 5 degree or angle of divergence of 5 degree or afferent to increase retention. Here the walls should be parallel for full gold crown preparation. Retainer of choice in mandibular posterior teeth. Full veneer crown, 3/4 crown, partial veneer crown or 7/8 crown. Here the answer is full veneer crown. Posterior abutment with acceptable crown root ratios, average crown length, normal aesthetic requirement. What is the retainer of choice? Is it full crown or resin veneer or partial veneer crown or none of the above? Here the answer is partial veneer crown. The choice of restoration in endodontically treated teeth, and also they are more extensively damaged anterior teeth. Then what is the choice of restoration? Is it metal ceramic crown or all ceramic crown or acrylic crown or all metal crown? Here the answer is metal ceramic crown. Since it's endodontically treated and also damaged, extensively damaged anterior teeth. Hence the choice of restoration is metal ceramic crown. What are the role of metallic oxides in porcelain? So they are added in porcelain too. Is it increase strength or provide color, improve bonding with metal, or all of them? Here the answer is provide color. Connectors height for ceramic FPD. 2 mm, 6 mm, 4 mm or 8 mm. Answer is 4 mm. For greatest retention of porcelain veneer, The coping design should be, is it convex with undercuts or no undercuts, or sharp angles or concave on facial surface? So for greatest retention of porcelain veneer, the coping design should be convex with no undercuts. Either dimension for the luting agent space is 0 to 20 microns or 40 to 80 microns, 20 to 40 microns or 80 to 120 microns. The answer is 20 to 40 microns. What is the property of ceramic? Is it a high compressive strength and low tensile strength, or equal in compressive and tensile strength, or high in compressive and high in tensile strength, or low in compressive and high in tensile strength? So the property of ceramic is compressive strength is high and tensile strength is low. In the mandibular posterior region, which of the following designs indicated for the pontic in the fixed bridge? So here the mandibular posterior region, is it spheroidal or ridge lap, modified ridge lap or conical? Here the answer is spheroidal type. Rough, poorly polished areas of pontics may cause halitosis or discomfort, or chronic inflammation of ridge tissue, or all of the above. Here the answer is all of the above. So rough, poorly polished areas of pontics may cause halitosis, discomfort and chronic inflammation of the ridge tissue. The pontic design of the choice in the appearance on of the maxillary and mandibular bridge. Is it hygienic or saddle, or modified ridge lap, or conical? So here in the appearance on in maxillary and mandibular dentures, that is modified ridge lap. Most suitable pontic for maxillary posterior area. Is it true pontic or long pin pontic, or sanitary pontic, or flat back pontic with porcelain facing or pin facing pontic? Here for maxillary posterior area, most suitable pontic is true pontic or long pin pontic. What is the best pontic for maxillary posterior teeth? Is it point contact, or true pontic, or composite or bullet nose? Here also the answer is true pontic. So best pontic for maxillary posterior teeth is true pontic. What is pearl pontic? Is it ovate or hygienic, or conical or modified sanitary pontic? Here the pearl pontic is modified sanitary pontic. The unit of FPD that attaches abutment to the suspended unit. Then what is it? Is it connector, or pontic, or abutment, or retainer? So here this is the part which attaches the abutment to the suspended unit, that is retainer. What is spark corrosion and what it consists of? Is it metal etching, or eroding the fitting surface of the crown, or electric discharge machine, or eroding through acids? So spark corrosion, it consists of electric discharge machine. Post-anchor is preferred to posterior crown abutment tooth as it is stronger, better aesthetically, independent of the abutment tooth, or less tear time fabrication. Here the answer is independent of the abutment tooth. Most common cause of failure of FPDs: caries on abutments, retained roots, periapical lesions, or wearing of the pontics. So caries on abutments is the most common cause of failure of FPD. And that's all for today's lecture. And please do like, share and subscribe my channel for more videos. Thank you.